Nearly 3,000 dead. And the president just moments ago saying challenging times are ahead. In New York City tonight, more than 250 dead in just 24 hours. And the difficult images this evening showing bodies being loaded into refrigerated trucks at hospitals in New York. The Navy hospital ship, the Comfort, arriving in New York City. A field hospital going up in Central Park. The governor just today saying we are now beyond staggering. This comes as President Trump, after first suggesting America be reopened by Easter Sunday, now extends the federal stay-at-home guidelines until April 30th. And the president moments ago saying we are sort of putting it all on the line. The new estimates tonight, the potential death toll in the U.S., scientists now say as many as 200,000 Americans could die. And Dr. Deborah Birx adding, that's if we do things perfectly, if we all adhere to the guidelines. In some places tonight, checkpoints now at state borders. Major cities in the Midwest bracing for the worst. Chicago and Detroit, and what they're seeing already. The stories from the front lines tonight, the well-known neurosurgeon who has died. The Miami ICU nurse who has died as well. A doctor, a grandfather of 6, and marathon runner in intensive care tonight. And the shortages, not just protective gear, masks, and ventilators, but supplies including Tylenol. In California tonight, the surge now being seen, ICU visits doubling. And in Washington state tonight, the choir that rehearsed earlier this month, keeping their distance, now reports tonight at least 45 members have been diagnosed or are ill, reports at least 2 dead. Tonight, cases doubling in Louisiana this weekend alone, and inside one Louisiana church, more than 1,000 gathering. And in Florida, the pastor who urged congregants to attend Sunday services is now under arrest. The new questions tonight over masks. Should Americans, if they have them, be wearing them? Would it help? What the scientists, including Dr. Anthony Fauci, are now saying. And Dr. Jen Ashton right here again tonight, answering your questions.
This is ABC World News Tonight with David Muir.
Good evening, and it's great to start another week with all of you at home. And we begin tonight with the widening toll coronavirus across this country. President Trump saying just moments ago, challenging times are ahead for the next 30 days. It comes after the president reversed course on trying to lift restrictions by Easter, after recommendations from his own doctors and scientists on his team who are now saying, even if we do it all perfectly, follow these social distancing guidelines, we could still see up to 200,000 Americans dying from coronavirus. We will carefully get to it all tonight, and this evening, the new numbers now in. Soaring. In just 2 weeks' time, we've gone from about 4,000 cases to more than 159,000 cases tonight. Nearly 3,000 people have died. Tonight, at least 37 states now telling people to stay at home, about 1 in 3 Americans now under restrictions. In New York City tonight, the epicenter of the U.S. outbreak, the U.S. Navy hospital ship Comfort has now pulled into port with 1,000 beds to help hospitals that are simply overwhelmed. A field hospital is now up in Central Park. And this grim image in Brooklyn tonight, a body being loaded into a refrigerated truck. New York's governor today calling the virus death toll, quote, beyond staggering already. 250 deaths in the city in just 24 hours. Tonight, we are out across this country, hospitals in New Orleans, Detroit, and Chicago stretched to the limit. And new questions tonight about wearing masks in this country. If Americans have one, should they be wearing it? Would it help? What the scientists are now saying and what the president said just moments ago. We will get to it all tonight, and we begin with ABC's chief national affairs correspondent, Tom Llamas, leading us off.
Please stay inside. Please pray for the people.
Tonight, the governor of New York says the situation is painfully clear, and these images show it. A body loaded into a refrigerated truck outside this Brooklyn hospital. The city bracing for a mounting death toll, more than 1,200 lives lost.
We've lost over 1,000 New Yorkers. To me, we're beyond staggering already. We've reached staggering.
Help sailing in today. The naval hospital ship The Comfort pulling into New York Harbor, the 1,000-bed facility ready to take on extra non-COVID-19 patients.
We've done this in war zones, in earthquake zones, and things like that, so we know how to do this. We've never done it in some place like this before.
In the heart of Manhattan, a new field hospital specifically built for COVID-19 patients. The group Samaritan's Purse building it in just days. Starting tomorrow, this is going to be a working intensive care unit in the middle of Central Park, complete with hospital beds, ventilators, overhead lighting, even a negative pressure tube sucking all that contaminated air out, making sure the room is sterilized. As New York is pushed to the brink, health experts warn the potential U.S. death toll could soar as high as 100,000 to 200,000 people.
I think it's entirely conceivable that if we do not mitigate to the extent that we're trying to do, that you could reach that number.
The president forced to reverse an earlier proposed plan to reopen the country by Easter, now extending social distancing guidelines to April 30th. Dr. Anthony Fauci saying the task force argued strongly with the president to extend them, and the president listened.
Challenging times are ahead for the next 30 days, and this is a very vital 30 days. We're sort of putting it all on the line, this 30 days.
Tonight, we're learning one of the latest victims is pediatric neurosurgeon Dr. James Goodrich from New York's Montefiore Medical Center. The world-renowned doctor making medical history when he successfully separated conjoined twin boys during a 27-hour surgery. Doctors across the country struggling to help families unable to visit their loved ones in the ICU.
We make it a point to call families twice a day, but I can't imagine being that person on the other end, having to wait for that phone call, never knowing what sort of news you're going to get.
An emotional toll also on nurses who are so often the critical link between patient and family.
I just came from a patient's room. He's actively dying, positive diagnosis of COVID-19, and his family can't come, so I had to FaceTime his family, and it was just so heartbreaking.
In New Jersey, 8 patients dying at a single nursing home. And 911 call centers stretched thin as well. In New York, a record 6,000 calls in one day. First responders also hit hard. About 5,000 members of the NYPD are out sick. More than 900 officers and 260 firefighters testing positive. And now in New York City, a $500 fine for anyone ignoring social distancing rules.
The police and all our agencies are authorized to use fines. We've given enough warning.
Tougher penalties in Maryland as well, where cases surged 400% in just the last week. 66 residents infected at one nursing home. The governor ordering residents to stay at home or risk up to a $5,000 fine or jail time.
This region is about to be hit with the virus in the same way that some other major metropolitan areas have been.
In Louisiana, officials say they need 14,000 ventilators and fear they could run out next week.
If the metros and the rural areas don't take care now, by the time you see it, it has penetrated your community pretty significantly.
Cases spiking in cities like Chicago and Detroit. This convention center in the Motor City is going to be turned into a 900-bed hospital. And in Philadelphia, this arena at Temple University transformed into an overflow hospital after cases in that city topped more than 1,000. And tonight in Los Angeles, the Naval Hospital, the Mercy, already taking on extra patients to ease pressure on so many hospitals.
That image from Los Angeles. We also took note of that image right behind you today here in New York City. Tom's in front of the Comfort tonight, the Navy hospital ship. And Tom, we know this is going to be for other patients as the hospitals in the city try to deal with patients who have coronavirus already overwhelmed. So when will the ship there be able to take some of those other patients?
David, I'm told they're going to be able to see patients starting tomorrow. It is a massive ship, and it got here earlier than expected. David, one more note at the top of the broadcast. You said more than 250 people died here in New York. That's hard to put into perspective, but here's even more perspective. Every 6 minutes, someone in New York right now is dying of COVID-19. David?
Yeah, it's just impossible to fathom. Our thanks to you, Tom, again tonight. The surge in cases, of course, is being seen across this country, not just in New York City. And tonight, what we're seeing and hearing from the front lines in California and from Chicago to Detroit to New Orleans. And the growing death toll for the healthcare workers. That well-known neurosurgeon we reported on there a moment ago, also the longtime ICU nurse, both dying from the coronavirus. And tonight, the shortages. Some hospitals remain in need of masks, those ventilators, now even Tylenol. And there is news coming in tonight on a church choir in Washington State who rehearsed many days ago. They thought they were keeping a safe distance. Tonight, at least 45 now sickened. At least 2 are reported dead. Here's ABC's Matt Gutman from California.
Tonight, the virus attacking frontline doctors and nurses. Miami ICU nurse Araceli Buendia Illegan, who treated thousands of patients over 3 decades, on Friday dying with alarming speed. She'd mentored her niece Joanna, also an ICU nurse, in England.
How do you feel going back to work? What does that make you think about?
Well, to be honest, I'm terrified for my life, because especially what happened to my aunt.
Dr. Arnold Weg believes he contracted the virus when a patient coughed on him.
My father is truly in the fight for his life.
Weg is a 63-year-old grandfather of 6 and a marathon runner. He's now in intensive care for the first time as a patient.
Yesterday was my parents' 38th wedding anniversary, and this is the first time they couldn't spend it together.
Hospitals now reporting drastic shortages of masks and protective gear. Doctors telling us they have a single mask assigned for an entire week. A national survey found 88% of cities do not have adequate supply of PPE.
I have nurses that call me on a daily basis to tell me that they're scared, to tell me they don't know what to do. We didn't sign up for this.
Mary McDonald recorded this video saying it's not just supplies, it's basic medication.
We're out of Tylenol. We're out of Tylenol. I don't know what I can do to save people anymore.
Tonight, California officials warning they're on the verge of a massive spike. The state has at least 5,700 cases and rising.
When the mayor says that he's seeing a surge in Los Angeles, where is that?
It's all over. So what's probably most concerning is the number of COVID-19 patients who need ICU admission doubled over the weekend.
But testing is slow. On average, it's taking 7 days to get results.
We have currently over 60,000 tests waiting for results.
One doctor on the front lines facing a cruel twist of fate. This moving image showing Arkansas medical resident Jared Burke's social distancing from his own 1-year-old son, Zeke. And then on Saturday, an EF3 tornado destroying his family's home.
It felt like the house lifted up and then slammed back down. I was saying, God, I'm not ready to die yet. And luckily, I guess he heard me because I'm still here.
And north of Seattle, the latest example of how infectious the virus can be. A choir meeting on March 10th for a rehearsal after the outbreak had started. They tried to practice social distancing and used hand sanitizer, but tonight, 45 of the 60 who attended are infected. At least 2 have died.
This is only going to lead to more questions about the droplets, those tiny, minuscule droplets in the air. And in the meantime, Matt Gutman with us live tonight. He's at a new testing site in Los Angeles, and Met officials there are now telling you they're ramping up the number of tests. They're trying to improve the speed of getting results.
That's right, David. Last week, the city of LA had 0 tests. This week, they're doing about 2,000 a day. Next week, they hope to get it up to 10,000 a day. Now, the medical director here told us that ramping up testing is pointless unless they can cut the lag time in results to about 24 hours. If people have to wait a week for results, they could be out in public spreading the virus. David.
Of course, we've heard of people waiting longer than a week, in fact, as well, Matt, thanks to you tonight. And we are across the South this evening as well, as cases now spike in the newest hotspots. And we took note today of what we heard from top White House advisor Dr. Deborah Birx, warning that no state will remain untouched. ABC's Marcus Moore tonight from New Orleans.
Tonight, for the first time since Hurricane Katrina, the New Orleans Convention Center transformed to deal with an unfolding catastrophe. And a usually vibrant city is bracing. This is the historic French Quarter tonight. It is shut down, and health officials fear that Mardi Gras, that brought thousands of people right here to Bourbon Street, may have helped to spread this highly contagious virus. Over the weekend, cases of COVID-19 in Louisiana soaring from roughly 2,700 on Friday to just over 4,000 today.
We still have an awful lot of work to do to try to flatten the curve.
But that didn't stop hundreds from flocking to Sunday services at Life Tabernacle Church outside Baton Rouge.
They were all spread out, probably 1,200 or so.
Some of the church's neighbors outraged.
We have a right to, man. Y'all need to shut that church down.
In Tampa, one megachurch pastor also defying stay-at-home orders.
People have gone totally crazy. As the president said, he wants to get everybody back worshiping God come Easter Sunday. That needs to happen.
But hours later, the president changed his tune, and tonight, that pastor under arrest.
His reckless disregard for human life put hundreds of people in his congregation at risk, and thousands of residents who may interact with them this week in danger.
And David, the governor here in Louisiana said it is grossly irresponsible to ignore the stay-at-home order, adding that those who do take the time of first responders, making it more likely this virus will spread. David?
All right, Marcus Moore live in New Orleans, where they're seeing this as well in really stark numbers. Marcus, thank you. And what about masks? If Americans have them, should they be wearing them? Would they help? Of course, the medical community doesn't want a run on masks, but what the scientists are now saying if you have one, and what President Trump said about this just moments ago. Steve Osunsami at the CDC in Atlanta tonight.
Health authorities in Asia, where the numbers of COVID-19 cases are improving, say that Americans have it all wrong with face masks. The head of the Chinese Center for Disease Control tells Science Magazine that the big mistake in the U.S. and Europe is that people aren't wearing masks. Many people have asymptomatic or pre-symptomatic infections. If they are wearing face masks, they can prevent droplets that carry the virus from escaping and infecting others. They believe that even masks made of simple fabrics are helpful. Jeremy Howard, a research scientist at the University of San Francisco, has looked at data from South Korea, Hong Kong, and Taiwan.
And they all tell the same story, which is that wearing a mask can decrease transmission by up to 50%.
In Geneva today, the World Health Organization came out and said the exact opposite.
We don't generally recommend the wearing of masks in public.
Dr. Anthony Fauci says part of the issue is supply, that if health workers weren't struggling with a shortage of masks, authorities might recommend them for everyone.
We're starting to re-examine the possibility that if there are enough masks, should everyone be wearing masks?
The president just spoke on this issue and says that he's open to this idea too, saying that his administration might recommend that all Americans wear masks all the time for a short period of time. David?
All right, Steve Osunsami on this issue of masks again tonight. Thank you, Steve. And in a moment here, Dr. Jen Ashton with your questions tonight, and word of a new combination of drugs now approved by the FDA to fight this virus. Dr. Jen on that. And remembering a country singer who has now died from the virus.
AT&T has connected us every day for over 100 years. And we are here for you, especially now, doing everything possible to keep you connected. Through the resilience of our network and people, we can keep learning, keep sharing, keep watching, and most of all, keep together. It's the job we've always done. It is the job we will always do.
You know, new customers save over $1,000 on average when they bundle home and auto with Progressive.
Wow, that's... And now, the Progressive Commercial Halftime Show, featuring Smash Mouth.